morning. My name is Amina Hall, and I am the event manager with the Health Collaborative. The Health Collaborative is a nonprofit, multi-stakeholder organization based in Cincinnati, Ohio. We are the hub for healthcare in the region, and collectively, we work together to help serve the community. We lead data-driven improvements that result in healthier people, better care, as well as lower cost. And our services include a robust set of improvement-oriented benefits to our memberships, including our 30 hospitals and healthcare systems, 150 long-term care facilities, and 100 select business partners. And today I have the pleasure of speaking to Alicia Lipton, who's the Director of Public Relations with the Hoxworth Blood Center. Hey, Alicia, how are you?
I'm great. Thanks for having me, Amina. How are you?
Oh, I'm doing well. I'm so excited to talk to you. I honestly have a funny story. I remember the first time I donated blood. I can vividly remember that experience. And I was excited, going into the blood drive mobile, and I was like, this is my first time. What do I do? I was kind of nervous. I didn't know what to expect. And I have really, really small veins.
Oh.
And they tried to, stick me a couple of times. And they're like, well, you've got really small veins. And they did the little tourniquet. And they're like, I'm sorry, but you're just going to have to take your apple juice and cookies and go.
Oh. Well,
they didn't want
we're
to
glad you tried.
Yeah, they didn't want to have to keep sticking me. And I felt so bad, like, oh no, what do I do? And they're like, it's not you, it's just, you have really small veins. And I just was like, oh man, I was so excited about doing it. So, and I've tried a couple more times. And I think I was successful once. And, they were able to get it going. But yeah, I have these small veins, and I was just like so disappointed, like I really wanted to do it. So, tell folks, first of all, who is Hoxworth Blood Center for those who have been maybe living under a rock and have never heard of Hoxworth Blood Center.
Okay. Well, Hoxworth Blood Center was established in 1938. We are the second oldest blood center in the nation.
Wow.
Cook County Hospital in Chicago beat us by 1 week. We've been around for a long time. At the very beginning, we were based out of General Hospital, which of course is now UCMC. But back in 1938, we had General Hospital here in Cincinnati.
Okay.
Right now, we started with 2 employees, which was Dr. Hoxworth and his wife. Now we're up to a complement of 300 employees and about 400 volunteers. And we serve over 30 hospitals in the tri-state. The special thing that I find very special about Hoxworth Blood Center is we're the steward of the local blood supply. So when you make that blood donation, it's going to be serving somebody here in the tri-state. So
nice.
It's going to be a neighbor, a colleague, a family member, somebody here at home. So when you donate blood to save a life, you're saving lives close to home.
Nice. Very nice. That's important. And I actually was going to ask you that. That's a perfect segue into my question about, what's the difference between Hoxworth Blood Center and like a nationally recognized blood center? So it's the blood is staying here. You're not shipping it to California or New York or somewhere.
Right. There are times, maybe in times of tragedy, that somebody reach out and say, we need type A blood. From time to time, we've had to ship blood following hurricanes or after national disasters.
Yeah.
And we've had enough here that we could meet all of our tri-state needs, that we could help out partners in the rest of the United States.
Okay.
On a daily basis, the blood you donate is going to stay here in the tri-state community to serve your community, your neighbors, your family members, your friends.
So tell me, what can someone expect for their first time donating blood? If they said, hey, we're having a blood drive at the office, you should sign up. For someone who's never donated blood, are there certain requirements or things that they need to do to get ready before they do their blood donation?
Yeah, that brings up a really good point. We have, first-time donors, so folks who've never donated before. And then we have what we call kind of a different type of a first-time donor. Maybe their last donation was in high school in 1987, and they haven't donated since. So we want to welcome them back as a first-time donor again, because things have changed
Yes,
since
yes.
1987. So when you come in to donate blood, we're going to have you fill out some paperwork, and it's going to ask things such as medications that you might be taking,
Mhm.
history. We're also going to do a brief mini physical where we're going to check your temperature. We're going to check your pulse, your heart rate. We're also going to do a very small poke on your finger just to get a small droplet of blood, and that's to check the hematocrit, or the iron in your blood, to make sure it's safe for you to be a blood donor. While you're in that booth with us, we're going to go over the medications that you're on. Some medications are perfectly fine to take. Antidepressants are fine. They're not going to keep you from donating blood. However, an antibiotic will. So if you're taking an antibiotic, you need to be off of that cycle. So if it's somebody who's on an antibiotic for a long-term basis, to defer them from donating blood.
Okay, okay.
Medical diagnoses could defer you. But that's something that changes on a regular basis. So just because you were deferred 5 years ago because of a diagnosis or a medication doesn't mean you'll be deferred today. So we always encourage you to give us a call when we can go over that information.
Okay.
Then we're going to take you to the actual donor chair. And depending on where you're donating, if you're on one of our donor buses, it's kind of a laid back, reclining, comfy chair. If you're in our donor center, it kind of looks like a big recliner. If you're in a location set up at a school or a business, they are kind of looking like heightened lawn chairs. So they're taller, but we'll sit you back in there. Our phlebotomist will explain to you everything that they're doing throughout the process.
Okay.
The needle they use is very small. You watch it on TV, don't get scared, because of course TV needs to have the drama effect. Nobody comes in with great big needles. So very small, tiny needle. The longest that it would be in your arm would be 15 minutes. Most people, it's going to be around 8 to 10 minutes.
Okay.
Take that out, bandage it, and then we're going to thank you because you potentially saved up to 3 lives with that one donation. And then on to everybody's favorite part is juice and cookies.
Okay, yeah. Nice. Are there age requirements? I heard you say high school. So do you have to be a certain age? Can you be too old, too young to donate blood?
You have to be at least 16 years of age to start donating, and at 16 you need a signed parental consent.
Okay.
At 17 you're fine, so no consent is needed. And bringing up our high schools, we're kind of looking at an issue this year because we don't know what's going to go on with COVID. High schools typically bring in about 15% of the collected blood that we
Wow.
see. But that really took a turn in March because high schools went to online learning, businesses were closed down. Some high schools will not be starting back up in the fall. So we're trying to relook at how we'll do our high school donation program.
Yeah.
And as far as the upper age limit, there is no upper limit.
Okay.
Right now, my oldest donor is 94.
Nice.
And because you're healthy and your medications do not preclude you from donating, we encourage you to keep doing that.
Yeah. Okay. So about the pandemic.
Yes.
Why is it so important, especially now that you mentioned high schools and some businesses were shut down during the earlier part of the year? And so you weren't able to get, a lot of donations that you normally would have. So why is it so important for, individuals maybe to call and schedule to register to donate during this time, during, this unprecedented time? I'm sure blood donation can go a long way.
It really can. And, a pandemic is something that nobody could truly plan for, especially
Yeah.
at at this level. We've seen, flu before and how that has affected us. But this was something that, nobody would have ever thought that we would be dealing with schools closing, businesses closing, restaurants closing. Fortunately, along with that, disease and trauma, they don't get to close. People are continuing to have surgeries. They're continuing to have cancer treatments. There continues to be trauma and car accidents. And all of those things can and do use blood. So we need to have that on the shelf before the patient needs it. So during this time of the pandemic, we actually had to quit having drives on our mobile buses because we could not sustain the spacing. 6-foot distancing between everybody. So we shut those down in March, those back up in July with new spacing requirements. So a bus that might used to be parked, let's say at a church or a Kroger, that would normally see 50 to 70 donors come through, we cut that back so that we're now only seeing about 20 to 25 donors come through.
Okay.
The reason we've started it back up is we need to make blood donation convenient. At the very beginning of COVID-19, if people weren't working, it may have been easier for them to come to one of our donor centers because trying to juggle getting home from work or getting off work and dealing with traffic. Now that they're starting to go back to work, it's harder for them to get a donor center visit into their day. So we've started adding in those buses again. And again, that started in July. We also always recommend that people make appointments, and the appointments are needed so we can do the social distancing. So we make sure we don't have too many people coming in at the same time.
Right.
We also need to be able to gauge what type of blood do we have on the shelf and what do we need going forward, so that we can keep our hospitals informed. Our hospitals keep us informed when they know of a surgery that can plan ahead and know that it will be a heavy blood user. For example, a liver transplant can use a lot of blood. So our hospital partners are great with letting us know, hey, we've got this scheduled for Wednesday. But then you never know what else is going to happen. It can take just 1 or 2 patients to totally deplete a daily collection of blood, depending on what their medical condition might be.
How many donors per day do you need? Do you have a target every day? Like we need to have 200 donors or?
We actually need 400 donors every day.
Every day. Wow.
Every day. Yeah, 400 blood donors. And then we need to see an additional 40 to 60, depending on the need, of platelet donors. And platelet donors are just critically important. One, because the shelf life of platelets is only 5 days. So there's a very short time to get that collected, tested, and then back to the patient. It's also a product that's used for our cancer patients, people who are going through chemotherapy, people who are having bone marrow transplants. So those platelets can truly be life-saving. And we constantly have a need for platelet donors to come in. With platelets, you can actually donate more frequently than you can whole blood. Whole blood you donate every 56 days. With platelets, you can donate every 2 weeks.
Oh, wow. Okay. Yeah, I was curious about that. How often can a donor donate? Is it several times per year? But you said every 56 days for
every
whole
56
blood.
days for whole blood, and then every 2 weeks for platelets.
Okay.
The other product that we're needing right now is plasma. And the reason plasma has been brought on by this pandemic. There's been some studies, we've worked with our area hospital partners, and that patients who are diagnosed with COVID-19, while they're currently in that fight, if they receive plasma from somebody who's recovered from COVID-19, they are seeing positive results. So we are collecting what's called recovered plasma.
Okay.
This point in time. So anybody who's watching, we really encourage you, if you have recovered from COVID-19, to go onto the Hoxworth website. It's hoxworth.org. You can find the COVID information and then register to be a donor for that convalescent plasma.
Okay. Okay. So if, like, for instance, someone is having a surgery, now they're doing a COVID test before
Right.
they take the
Mhm.
surgery. Is that a
Mhm.
requirement before you come to donate blood, that you have to have the COVID test to see what your results may be before you donate, or no?
No, you don't.
Okay.
Uh, However, lots of people are being tested right now, either because their doctors have done the test because they've had symptoms, or
Mm-hmm.
some people that are like, I wasn't feeling very good in March and my test came back negative. I wonder if I had COVID-19, and there's pop-up clinics going on. So if you are somebody that has tested positive for COVID-19 through your own medical professionals, and you've since had negative antibody testing or positive antibody testing, you can provide that documentation to us through our registration program, and then we can get you into the convalescent plasma donation format.
Okay. Okay. Very good. Is there an urgent need for a certain type of blood type, like A positive, or is there, something where you're like, we have like a need? I've sometimes have seen emails come in where they say we have an urgent need for O negative, and if you're O negative, sign up. Is there something like right now where you're just like, we need this immediately?
Mhm. Well, one rule of thumb is, people will say, Alicia, what's the rarest blood type? And to answer is, it's always the one that's not on the shelf when we need it the most. And that can change daily, just depending on what the needs are of our hospital partners. However, we always have a need for our type O donors, because our O's are our universal donors. So we need to have a plethora of O products on our shelf. Right now, we also have a very large need for AB donors who are male. So if anyone out there viewing today is AB and male, we need you to come in right away for a plasma donation. And then we're also in need for B positive donors. So if you're B pos, we'll need you to come in. And Amina, you're right. From time to time, we will put out those messages through social media or email saying, we need you now. And when we do that, it's true. It's because there is somebody at the hospital or several people at the hospital with that particular blood type that are needing to be transfused.
Got it. Got it. Okay. So I heard you mention about your mobile buses and trying to make sure social distancing, is taking place with those mobile donor buses. What other things have you implemented and had to change with the services that you're providing to make sure that those social distancing practices are upheld and folks feel comfortable and safe in a sanitized environment when they do donate blood?
Safety for our donors is a top priority. So that was something that we addressed head on. I believe our first day of doing new protocols was back on March 9th, which sometimes seems like yesterday, other times seems like eons. It's like, is it still March? No, it's July. But we have made a multitude of changes. One is social distancing. So even in our donor centers, we have spaced out the donor beds. We've also spaced out the waiting area so that we are keeping people spaced apart. We started at the beginning with all of our staff wearing masks, and we encourage donors to, but we have since changed that so that everybody coming into the blood center is required to wear a mask. If a donor comes in and they don't have a mask, we'll have one available for them. But again, that's for the protection of the donor and also for our staff members. Our staff are wearing gloves, and those are being changed between each donor that comes in. And then all hard surfaces are being wiped down between each donor. So that would be the donor chair that you're sitting in. It could even be the tablet that you're registering on. So all of those are being wiped down. Donating blood is very, very safe. Very beginning of COVID-19, our governor, director of health, everybody was very great with saying donating blood is safe. Just as going to the hospital is safe. People still have emergencies, so you still need to see doctors. We need people to donate blood, so we're doing everything we can to keep that environment safe for our partners and also our employees.
Very good. Okay. Well, Alicia, I just have one more question for
Okay.
you. How has partnering with the Health Collaborative helped the mission of Hoxworth Blood Center?
Being partnered with the Health Collaborative has been a huge help. For several years going back, we've enjoyed that partnership. But right now with the pandemic, it has been wonderful with all the hospitals coming together and being able to have, whoops, my camera's moving. I have a puppy back here moving it. Sorry about that. Whoops. But with partnering with the Health Collaborative during the pandemic, we've been able to have that joint messaging with our hospital partners.
Mm-hmm.
We've been able to let the entire community know that yes, it's safe to go to the hospital. It's also safe to donate blood. And that's just been huge. Being able to be on calls with our hospital partners that have been set up by the Health Collaborative has been huge, so that we know what's going on in their health systems, and then we can better adjust our practice at the blood center.
Good, good. Well, thank you so much, Alicia. This has been wonderful, and I do hope that some folks have been able to learn more who haven't donated or haven't donated in a while. And how can someone register and sign up to donate if they don't have a blood drive taking place in their office setting right now? How can they get in touch with Hoxworth?
Well, they can always go online and register, and that's at hoxworth.org. You can also give us a call at 513-451-0910, and we'll find a blood drive that's convenient to where you live or work.
Okay.
If you've donated before and you're a little hesitant, a little nervous, now's the time to step up to the plate. And if you're nervous, let me know. Give me a call. Ask for me personally, and I'll be happy to be there for your blood donation and walk you through the process. It's something that we can all do and give back to our community, and it's just a way to be kind. If you yourself can't donate, and there are several people who can't, maybe because of medications, travel restrictions, medical diagnosis, that's fine. You can still help us. You can encourage other people to donate and let other people know about our needs.
Okay. Well, thank you so much, Alicia. You're doing a wonderful, wonderful job, and we enjoy the partnership with Hoxworth Blood Center. And I really hope that we get through this year and we can look back on this and say, whew, we made it.
Yes, definitely. I'm sure that there's going to have to be, a big party when all of this is over with. And we'll all sit back and think, how did we do that?
Yes. Yes.
We've done it, and we're survivors, and we're going to continue to go forward.
Absolutely. Absolutely. Well, thank you so much, Alicia, and hope you have a wonderful day.